Good morning, everybody. My name is Dr. Jeffrey Brown. I'm here in Northern Virginia, just outside of Washington, D.C. My team has asked me to do a little discussion about my understanding of dystonia. First of all, dystonia patients come to see us and they're literally have their heads cocked off to the side like this. When things have gotten that far along, there's a lot of damage to both the neck, the jaw, the skull. What I see in every single dystonia case so far is that the articular discs within the jaw joints are out of place. They've been slipped off the top of the jawbone. Let me show you a demo. Let's see if I can get this in the screen. This, of course, is the lower jaw. The blue represents what are called the articular discs that should stay on top of the condyle, the jawbone, when you open and when you close, just like that. Now, in every single case of dystonia, I take an MRI to understand how badly the discs are slipped, and always these little discs are slipped anteriorly, which is forward, or laterally, which is outside, or medially, which is inward. And unfortunately, when it's medially tipped, it's very, very difficult to work with because, as you can see, the bend in the jawbone is here. If that disc gets up underneath there, it's really, really difficult for it to come outside and get back on top of the jawbone again. So that's the first thing that we see in every single dystonia case that I've ever met so far. So now let's imagine the disc is tipped this way. This one's tipped this way, which I just had 2 or 3 cases this week already, just like this. That's going to push the jaw this way effectively, the deviation on opening that we see. And what happens if your jaw goes to the side enough like this, you'll start compensating by doing this, and then the neck gets pulled with it too. So enough years of that happening, there is oftentimes permanent damage that has occurred because of these slipped discs. So let me show you the cervical spine, the neck. The way the physical therapy or orthopedics of your body works is that when the front of the face is out of place, it affects the cervical spine. So if your jaw goes like this, you can imagine it's going to affect C1 and C2 back here in the neck. This is the base of the skull right here, and down in there is C1, C2. So when things are pulling off to the side with your jaw, it affects the neck adversely. And we see this all the time. So these patients come to see me, their neck is off to the side, bent, and every single time, so far, every single time, the disc in the jaw joint is out of place. So what do you do about it? I'm in favor of mostly using what are called ALF appliances. However, when there's significant degeneration of that condyle and disc, back to this again, when there's a lot of damage here, I will often use the Gelb, the lower Gelb appliance, for quite some time, then eventually work our patient into an ALF appliance. Let me show you what I'm talking about. This is an example of the Gelb appliance that fits on the lower teeth. When the Gelb appliance is put in place, the jawbone, hard to do here, is no longer jamming the rubbery stuff, which is the disc. It doesn't push it out any further. It gives it a chance to heal and go back in place. That's basically one of the first steps. However, in every single case, I should say, of dystonia, the cranial bones are bent like this. We see this all the time. Every single day we get this. So you wear an upper ALF appliance to re-level the cranial bones. And if you look at a patient, inevitably, one ear is higher than the other. One eye is higher than the other. Everybody is affected differently by the slipped discs in the jaw joints, by the cranial bone distortion. And everybody asks the same question: what caused all this? Well, Dr. Fryman, many, many years ago, discovered that 95% of us have bent cranial bones upon birth, and they never get realigned. There is the original source of the problem. So you're bent like this inside, that slowly pushes the discs off the condyles, which slowly bends the neck, and years later you realize that you have dystonia. Well, in my world, I don't think dystonia is actually a diagnosis. I think it's a label for both slipped discs, cranial bone distortion, cervical spine distortion. All of these issues have got to be addressed, and that involves also working with a physical therapist, an osteopath, The whole body has to be worked on in order to get better. And that is one of the most important messages I can give you. This takes time. If you've been out of place for years, and as it turns out, 99% of the patients that come to see me have been out of place for years and years and years, it's going to take years to unwind it. Let's just face it. It will not happen overnight. And yeah, you'll see a few people on Facebook, on some of these people I treat, you put the appliance in and somehow magically the neck straightens up. But it doesn't last forever, and it's not a permanent fix. It's important to realize you've got to take this to completion somehow. And what that means is orthodontically grow the teeth up taller to support the joints long term. Work with the C-spine, the neck. If it doesn't get better, you'll always be in physical therapy. So this entire thing is quite a process. It takes time, it takes patience. People always ask about my success rate. Well, that's an interesting question. I have, on my other computers, I have x-rays to show people when they come to see us that the cranial bones have been indeed leveled, nicely aligned after about a year. However, the MRI still shows slipped or displaced discs. The patient feels better, doing better, life's better, but have we fixed the underlying problems? No, we have not. We've just given them a better life. Now they can manage better. This is one of the conundrums that I have to deal with every day, is getting the articular discs back in place. So what I do with all of our patients is I do a starting MRI, starting skull x-rays, and then we document everything very, very carefully. Then a year or so down the road, reassess, get a new MRI, get new x-rays, tell the patient where they're at. Either they're better, the same, or worse. It does happen worse. And we talk about it. Should you do microsurgery to fix the damaged discs? The problem with it is if the discs are out of place and the C-spine is terribly out of place too, you shouldn't do surgery to fix this, because this will throw out the TMJs again. It's a terribly vicious cycle, and you just have to identify it all and talk with the patient about it. So as you folks are dealing with dystonia, remember, it is a TMJ problem, it's a cranial bone distortion problem, it's a cervical spine problem, and it's a problem that goes down the entire spinal column through the whole body. So if the hips are out of place, it can throw off the TMJs. You've got to work with your PT, your osteo doctor, as you do the treatment. It's the only way to get better. We do have an expression in this office saying, we ain't FedEx. I can't do overnight fixes for anybody. I've had so many people over the years come to see me demanding absolutely that it be fixed overnight or within a month or 2 or 3. And when that doesn't happen, they get angry. And this is one of the things that I really have a difficult time with. In my paperwork that I give them all, I say I need a year or more just to see how you're doing. If you're doing better, that's wonderful, but we have to do an MRI to assess. So please keep all these things in mind as you talk about dystonia and you deal with dystonia. And you can always email me if you have any questions. It's at Brown, Dr. Brown, at Sleep and TMJ Therapy.com. And check out our website, www.sleepandtmjtherapy.com. Read the blogs. It will give you lots of information. I do talk about the successes and the failures. I try to be very honest with our patients that I don't have all the answers. I don't think anybody does. So take a look, let us know. Thank you.